Fair warning here, this isn't going to be a pretty earwax removal, because it really isn't an earwax removal. This is a case of keratosis obturans, so which is essentially a very dense plug of dead skin very deep in the ear, which causes extreme pain, hearing loss, and can lead to an enlargement of the ear canal due to a process called bone resorption. So if you're interested in learning a bit more about that condition, keratosis obturans, and what exactly it is and how it forms, I'll link you to another video where I discuss it in depth. But we are going to see a little bit of bleeding here. The ear canal is going to be fairly swollen, it looks a little sore, and there's also going to be a fair amount of debris and keratin left behind. So it's not going to be a complete removal, but what we're aiming to do here is make the patient more comfortable, resolve that pressure, resolve the hearing loss, and expose the eardrum and make sure that it's not perforated. So what we have here essentially is a very, very deep plug of keratin. Now the backstory is this patient actually reports that his ear has been feeling blocked for about a year, but due to the pandemic and probably some anxiety, he's kind of been putting it off. Within the last 3 weeks, it's starting to get very painful. So he's seen his doctor twice. The doctor has not referred him to a specialist or a practitioner of any kind. The doctor can't remove the earwax, so the doctor has basically said just use drops and use more drops and use more drops. And the patient has not only taken huge amounts of painkillers, probably too much, but has been using all sorts of drops, which has probably led to the keratin plug expanding a little bit, which has been hurting him a lot. Trouble sleeping, he's just had an awful time. So this is coming to see me for suction is really a last resort, despite how scared he is of the procedure. So you can see I'm just loosening this plug here. I rather suspect that he probably dosed up on quite a lot of painkillers before coming to see me, because he was fairly tolerant during this procedure. He was very still, obviously there's no screaming or anything like that. So he was a good patient, basically. Now we've removed this front part of the plug. Now have a look at what's behind that. So you can see we have a little bit of bleeding. I mean, it might well be serosanguinous discharge. I mean, it looks a little watery, or it might just be bleeding with, active bleeding with a little bit of serous discharge mixed in there. But I mean, that's pretty much the extent of the bleeding. This is a young, fit, healthy patient, so they're not on blood thinners or anything. So, you may ask, well, why didn't you stop the procedure due to that bleeding? And although obviously we try and avoid bleeding as much as possible, but it does happen sometimes, and this is not a huge amount. But even so, we've not really resolved the problem. Now, as I mentioned before, the patient has no choice but to come and see me for this procedure. He has not been referred to ENT by his doctor. So I really wanted to just go a little bit further, and if I can just see the eardrum and get the patient to do a Valsalva and see the eardrum flex, then I'll be happy, which is what I'm aiming for here. So going back in again, and what we're aiming to do now is just kind of very gently strip away this keratin, because again, this is a very sore ear. There's some edema on the left-hand side. So just to the left of the frame here, you can see how the ear canal's kind of swollen outward, which is, certainly not characteristic of, well, it's not characteristic of the ear canal generally, but it's certainly not characteristic of the bony portion of the ear canal, which is just a very thin amount of skin directly on bone, temporal bone. So you can see here it looks kind of cushiony. You'll see that a little bit more where how kind of pillowy this